The validity of goniometry is dependent upon the assessor's anatomical knowledge and skill in using the assessment tool. Only a difference of greater than 5 degrees should be accepted as significant. The inter-rater reliability of goniometry is less than intra-rater reliability. When measuring joint range of motion, the position of the surrounding joints should be noted and standardised for subsequent assessments. The goniometer is placed dorsally over the joint. The patient is asked to actively flex or extend the digit as far as possible. Verbal encouragement is given. The arms of the goniometer are allowed to rest over the joint. The range of motion is shown on the scale of the goniometer in degrees. The method of assessing interphalangeal joint motion is the same as that for metacarpophalangeal joint motion. However, when measuring the distal interphalangeal range of motion, the patient may need to perform a hook fist with the metacarpophalangeal joints extended to allow for placement of the arms of the goniometer. The interphalangeal and metacarpophalangeal joints are measured in the same way as the other digits. To measure abduction span, the goniometer is placed over the axis of the first carpometacarpal joint, with one arm lined up with the second metacarpal. The patient is asked to move their thumb away from the palm in a horizontal direction. The second arm of the goniometer is lined up with the first metacarpal, and the degree of motion is read from the tool. To measure extension span, the starting position is altered so that the patient's hand is palm down on the table, and they are asked to move their thumb away from the palm across the table. The starting position for measuring radiocarpal joint flexion and extension should be standardised. Placement of the goniometer on the dorsum of the joint may produce inaccuracies due to the extent of any edema. A more reliable method is for the patient to rest their elbow on a table with the forearm held vertically. The goniometer is then lined up along the ulnar and the fifth metacarpal. The patient is asked to flex or extend the wrist. Verbal encouragement should be given. The range of motion is taken from the scale on the tool. To measure radial and ulnar deviation, the patient is asked to place their hand palm down on the table. The axis of the goniometer is placed over the joint, and the arms of the goniometer are lined up with the forearm and the third metacarpal. Pro and supination of the forearm are the most difficult movements to accurately assess. The patient is positioned with the ulnar border of their forearm supported on a table. The goniometer is held on one side of the forearm, with both arms pointing vertically. The patient is asked to rotate the forearm away from the tool. One of the arms of the goniometer remains vertical, whilst the other is taken to rest against the forearm. The range of motion is read from the scale on the tool.